Hi, Javi. Dealing with the virus obviously hard enough, and the scary thing is you won't know if you have any of these lingering symptoms, lingering effects until they really happen. So this morning we're getting some advice with Dr. Stephen Sinatra. He's published more than a dozen books, and he is also a fellow of the American College of Cardiology and the American College of Nutrition. Thank you so much for joining us this morning, Doctor. We appreciate your time, Dr. Sinatra.
Thanks so much.
All right, let's talk about these bizarre, some of them are bizarre. We hear about these lingering effects. Is this often permanent, or is this something we can navigate with medications and therapies?
Well, first of all, we're learning about this virus every day. One of the things as a heart specialist that I realized is that about 40% of people can develop what we call myocarditis, or an inflammation of the heart, which can cause any symptoms like fatigue or shortness of breath, or even overt heart failure for that matter. There's another group of patients that in the range of 40 to 60% that develop neurological and even psychiatric symptoms. And this has to do with the virus locking into the receptor sites in the brain. They lock into what we call synapses, where the nerves communicate with one another. They steal oxygen, and the sequelae is fatigue and basically even sometimes disorientation and panic and situations like that. So this virus not only attacks the lung, but gets into the brain, the heart, the skin, the digestive tract, and so on. So it's a very virulent virus. And fortunately, for the second round, we'll be much better prepared than the first round, because we've learned how to deal with it.
And interesting, because we do hear about how it affects the lungs. We hear about that and not so much about the other things. So are there things that we can do ahead of time? We don't know we're going to get them, but just to better protect ourselves from having any of these long-term effects if you were to get COVID-19?
Well, I'm a big believer in targeted nutritional supplements, and there's enormous data out there, for example, on vitamin D, where it supports your innate and adaptive immunity. And there was a recent study that came out that really caught my eye. In fact, I did a Facebook Live on drsinatra.com with it. And basically, in a study of several hundred patients, they showed that if your vitamin D level in the blood was at a certain level, we can call it like 30 to 35 UGs per ml, that you did not get complications or even death, for that matter, from the coronavirus. And that really caught my attention, because there's a lot of people in the country that have blood levels that are very low, in the 10 to 15 range. And if they get the virus, for some reason, they succumb partially to some of the complications. So I think vitamin D is a knockout punch, and I've been recommending that my subscribers take at least 2,000 to 5,000 units a day. And certainly vitamin D and magnesium are synergistic, and I like magnesium as well. I've been a big believer in coenzyme Q10 for almost 40 years. I've written books on it.
I've heard of that, yeah.
Studied it in the cardiac population, and I really like that because it supports the endothelium. And this virus attacks the endothelium of blood vessels, so it just makes sense to consider coenzyme Q10 as well.
All right, we could pick your brain for days on this, because I think it's just fascinating. As you said, we continue to learn more information about it. And I know, Dr. Sinatra, you say that you have a podcast that you do, as well as a paper that you just wrote about the effects of COVID-19 and some of these symptoms. Where can we get a hold of that?
Yes, correct. Yes. Yeah, I mean, we wrote actually a paper for the American College of Nutrition. Like, certain foods can help. I mean, one of my favorite foods in combating this virus would be onions. It's amazing. I mean, onions contain quercetin, which is a bioflavonoid, and it's awesome. I mean, it protects the lung from respiratory illnesses. There's so many adaptogens you can take, astragalus, ashwagandha. There's so many things that people, unfortunately, they're not privy to. In other words, there's drugs that we can use. There's the hydroxychloroquine controversy. There's remdesivir. There's so many other pharmaceuticals we can take. But I'm a big believer in a natural diet. Less sugar, for example. If you take less sugar, remember this: sugar stifles white blood cell activity for hours. So less sugar in itself. Losing weight. We realize that one of the major comorbidities
Sure.
of this virus is being overweight. And we know that diabetics, for example, are behind the eight ball because it's a major comorbidity. So a simple weight loss of 5,
Dr.
10,
Sinatra?
15, 20 pounds is key.
Thank you so much for all that advice. We will take it to heart, and also we'll put all the info on how we can learn more about your thoughts on this on azfamily.com. We appreciate your time, Dr. Sinatra.
Thanks so much. Bye-bye.
We'll be right back, folks. Stay right here.